What is H. pylori? It's a type of bacteria, specifically a gram-negative spiral-shaped bacterium, that has uniquely adapted to live in the harsh, acidic environment of the stomach. While it might be surprising, about half of the world's population is estimated to have H. pylori in their stomach. For many, it doesn't cause any problems, but for a significant number of people, it can lead to serious digestive issues. Now you might be wondering, how does a person get infected with H. pylori? The primary routes of transmission are person to person. This can happen through oral-to-oral contact. This means the bacteria can be transmitted through saliva. Fecal-to-oral contact. This often occurs through the consumption of food or water that has been contaminated with fecal matter from an infected individual. Gastro-oral route. This can happen through contact with the vomit of an infected person. Infection is most commonly acquired during childhood, and it often spreads within families, for example, from parents to children, or between siblings. Crowded living conditions and poor sanitation can increase the risk of transmission. So, once H. pylori enters the body, what does it do to the stomach? First, it has to survive the incredibly acidic environment of the stomach, which is designed to kill most bacteria. H. pylori is a master of survival. It produces an enzyme called urease, which converts urea into ammonia. This ammonia neutralizes the stomach acid around the bacteria, creating a more hospitable microenvironment for it to thrive. Its spiral shape and tail-like flagella allow it to move through the thick mucus layer that protects the stomach lining and burrow into the lining itself. Once there, it attaches to the cells of the stomach wall. This is where the problems begin. The presence of H. pylori triggers an immune response from the body, leading to inflammation of the stomach lining, a condition known as gastritis. This chronic inflammation can disrupt the normal function of the stomach. For instance, the ammonia produced by the bacteria can interfere with the stomach's ability to regulate acid production. It tricks the stomach into producing more acid, which can further damage the stomach lining. Over time, this chronic inflammation and increased acid exposure can lead to the development of sores or ulcers in the lining of the stomach or the first part of the small intestine, the duodenum. In fact, studies have suggested that a high percentage of duodenal and gastric ulcers are associated with H. pylori infection. The symptoms of these ulcers can include stomach pain, bloating, and nausea. In a smaller percentage of infected individuals, long-term infection can lead to more severe complications. Chronic inflammation can cause atrophic gastritis, where the stomach lining thins, and in some cases, it can increase the risk of developing gastric cancer. It's important to note that while H. pylori is a significant risk factor, not everyone with the infection will develop cancer. Don't forget to like, subscribe, and leave any questions you have in the comments below.